Reasons not to soak. This is like a bad comedy routine, right? Reasons not to soak. Cross-contamination. You cannot effectively clean the bucket in between. Most surface cleaners say they need between 45 seconds and 3 minutes of wet surface contact. Hold on. People get upset at this point. Of wet surface contact. It doesn't stay on that long, does it? It doesn't stay wet. You can't clean it. You can use a disposable garbage bag that you change with each person and document. It's not only in your guidelines, but in each chart note that you have used a new liner in the bucket to soak their feet. Otherwise, you have no, if they get any kind of infection, that's the first question they're going to ask you, and you have no defense to them getting an infection. Even if you cleaned your instruments appropriately, if you soak their feet. So just hold on to your thoughts for a second. Let me finish this. So you can use a new liner bed with every patient and document it in the chart, not just in your protocols. In the guidelines for disinfection and sterilization, an important issue regarding the use of disinfections for non-critical surfaces in healthcare settings is that the contact time specified on the label of the product is often too long to be practically followed, which is what we just said. The labels of most products registered by the EPA for use specify a contact time of 10 minutes of wet surface contact. Such a long contact time is not practical for disinfection of environmental surfaces in a healthcare setting because most healthcare facilities apply a disinfectant and allow it to dry in less than a minute. And if you're cleaning a bucket, that's what's happening. You cannot justify that. We don't want the patients to think that soaking is a good idea. It's bad modeling. We don't know at home, we've discussed this, what they're soaking in, if the water's too hot, if the dog drank out of that at the last picnic. We don't know. It dries the skin. We don't want to model that behavior for them. Well, the nurse does it, so that must be good. Is their basin or bucket clean, or did the dog drink out of it? Did they fill it with water that was too hot, particularly a problem with neuropathy? Can cause burns. We've all seen it, or many of us have seen it. Soaking is very drying to the skin, and they can be using inappropriate soaking agents. Although soaking of the feet has been a traditional approach to treatment, it is of no benefit. In fact, it can lead to maceration and worsening infection. Because the foot is insensitive, soaking may take place in water that is too hot, resulting in severe burns. Now we're talking about it at home. Chemical soaks can result in chemical burns. It makes tissue planes harder to differentiate, making sanding or cutting with a scalpel harder. When I'm trying to cut a callus down and the tissue is wet, I can't tell when I'm through callus to good skin. Even if the foot hasn't been soaked, I have to cut a little bit off or sand it, whichever you're doing, and go do something else on the foot for a few minutes while this hardens up again. Once the part you've just exposed, you've taken a layer of the callus off, then the part under that was soft, in just a few minutes, as you're trimming other things, will harden back up. And then you can reach over there and go, oh no, there's a lot more here. Trim off a little bit more, then go and do something else on the foot for a minute. And it take me several times going back and forth sometimes, especially if I'm using a scalpel, but even with a sander, to make sure I don't go too deep. I want to stop just before normal skin. If this is a callus that's over a bony prominence, you want to leave some of the callus on for protection. I can't tell where that spot is if the skin has been soaked. I can't tell with a scalpel or a blade, so it makes it difficult for me to do my job properly. Whether sanding or using a scalpel, we need to be able to determine the harder callus material from the softer skin. If the skin has been soaked, this can be very difficult. It could result in less effective debridement or cutting too deeply. I don't have 20 minutes. I'm trying to see people. A lot of folks out there need me. I don't have 20 minutes. Whether it's at a clinic schedule or you're working on your own, you only have a certain amount of time for each patient. It's seldom possible to add an extra 15 minutes or so to add a regimen of soaking. You have to clean the bucket, you have to sit them down, you have to put them in there, and then wait, even if it's only 5 minutes, then it's another 5 minutes to clean them off and dry them. I don't have that kind of time. So even if I could do my job properly, and even if it wasn't a cross-contamination risk, I don't have time. cross-contamination, bad mopping, tissue planes harder to differentiate, don't have 20 minutes extra. Having said that, washing is different than soaking. Many feet need to be washed. Washing is different than soaking. Washing can take 5 minutes. I get that. But you're not putting them in a bucket of water. The bucket's usually on the floor. I do this with my homeless people. The bucket's on the floor. I'm cleaning them up with Physoderm or whatever. Whatever, I don't care what it is. Whatever that we can really use. And it's dropping into the bucket, and then we take tap water in a saline bottle and we, rinse it off. And in the meantime, we clean between the toes. I call it toe flossing. And we clean it up. Now, washing is different than soaking. It doesn't get the skin so wet that I can't do my job, and I can't tell tissue planes, and I can't use my Dremel. It doesn't take 20 minutes. I don't have to worry about cross-contamination because I'm not putting their foot in anything. Their foot is suspended. I'm cleaning it with a towel or whatever, and rinsing it off with water. That's washing. Washing is appropriate. Hold on to your thoughts. Okay, how do you convert patients? Because most patients, as well as some nurses, are used to soaking. But what are you going to do? What do you mean you're not going to soak my feet? These are wonderful seniors who don't get touched, who don't get pampered, who don't get that kind of consideration. First of all, I tell them about the infection risk. I say, I know you're used to that, and I know you've not had a problem. But as a healthcare professional, I have to tell you that I worry about germs in the water, that maybe the bucket wasn't cleaned properly. And I don't want to expose you to that. I say, I actually wouldn't put my foot in a bucket that someone else had had their feet in. Well, all you see is that, and they're like, whoa, never thought of that. Even if they bring their own bucket, I don't know where that's been. I don't know if the dog drank out of it the last picnic, and now they're bringing it in. So even if they bring their own bucket, tell them about drying effect on the skin. It's not healthy. I've already talked about what soap they're using and that I want them to use Dove. Tell them you're concerned about their health. Tell them that you do intend to pamper them. You're going to give them a wonderful foot massage at the end of the treatment. They'll love it. Those of you who have been to our class, what do they say as we're doing the massage at the end? Oh, I've been waiting for this. Almost every one of them. It takes exactly one time to convert them. And we might spend 30 seconds or a minute giving them a wonderful foot massage, and that's actually a long time. But it's 30 seconds or a minute, and I have no cross-contamination. I'm modeling something I want them to do, which is moisturize, and I'm out of there, and they feel pampered. So you want to exchange something that you don't want them to do anyway, that could give them an infection, that could leave you legally liable for causing an infection, that models bad behavior and will dry their skin, that makes it difficult for you to provide thorough debridement. You want to exchange that for something that will relax them, model good habits, and keep both you and them safe from getting or causing an infection.